Good afternoon. My name is Angela Taylor. I'm a licensed dietitian nutritionist and also a doctoral candidate at MUIH. Today I'll be conducting a journal club for the article entitled Efficacy and Safety of Spinning Exercise in Middle-Aged and Older Adults with Metabolic Syndrome, Randomized Control Trial. The mock patient that we were assigned is Case 5, Preventing Metabolic Syndrome and Misinformation. You can see all of this patient's relevant details here. I will highlight the relevant ones. He is currently taking prescriptions for Lasix for blood pressure and Lipitor for cholesterol reduction. His blood pressure is 155/103. His HDL cholesterol, or the good cholesterol, is low at 38. His triglycerides are high at 150. The fasting blood glucose is high at 120. To meet the criteria for having metabolic syndrome, a patient needs to test positive for 3 of these 5 screening variables. This patient is in fact positive for 4 of the variables, as well as he is taking prescription medication. So yes, he definitely fulfills the criteria for metabolic syndrome. So the research question that I asked myself when doing my literature search was, what intervention might this patient utilize to improve his health and reduce physiologic markers of metabolic syndrome? And in my search, I found this article entitled Efficacy and Safety of Spinning Exercise in Middle-Aged and Older Adults with Metabolic Syndrome, Randomized Control Trial. So these Italian researchers had the study aim to implement and compare interventions to improve metabolic abnormalities in middle-aged and older adults. So this was adults aged between 50 and 69 years old. Their study design was a randomized controlled trial, and it was divided into 3 arms. The first arm was diet counseling only. The second arm was a general gym program plus diet counseling, same diet counseling program. And the third arm was a spinning training program plus the same diet counseling. Oh, and by the way, there were 30 participants and they were randomly allocated, as you can see here, 10, 10, and 10. Okay, so the inclusion criteria. Participants, as we already said, were aged between 50 and 69, and they had metabolic syndrome. Exclusion criteria, so a participant would not be allowed to sign up for the study if they had resting systolic blood pressure above 200, diastolic blood pressure above 110, fasting blood glucose above 250, unstable angina, arrhythmias, severe heart valve diseases, aneurysms, or any kind of severe systemic disease. Okay, methods. Upon enrollment, physiologic data was collected for waist circumference, BMI, total cholesterol, HDL, good cholesterol, triglycerides, fasting blood glucose, and insulin resistance, HOMA. And as you can see, the patients were recruited. There were 30 recruits. They were then randomly assigned to group A, B, or C. So for the diet-only arm, well, actually all participants received this treatment. So the diet treatment was the same for all 3 groups, and it was comprised of telling people to consume 24 kilocalories per kilogram, and the researchers calculated their ideal body weight. Rather than their actual body weight when they began the study, they calculated how much they should be eating based upon what their ideal body weight is for each person, and then each participant was told how much to eat. Their diet compliance was monitored with daily food diaries, and these diaries were collected monthly. Now for group B, that was the general gym program plus the diet. So these folks received 2 one-hour sessions of physical exercise every week in a group setting, and this was under the instruction of a therapist. All the patients followed a group exercise program which consisted of walking and balance test, posture strengthening, and treadmill exercises. And all patients were instructed, do not exceed 75% of your maximum pulse rate. All right, and group C was the spinning program plus the diet. And so this was 2 one-hour sessions of spinning exercise a week in a group setting, also under the instruction of a therapist. And all patients followed the same group exercise program, which was muscle warming, then their 45 to 50-minute spinning workout, and this was accompanied by a music playlist of between 13 to 15 songs. and physical deconditioning after that. Each patient could adjust the resistance of the bicycle through a handlebar placed device according to their own feeling of fatigue. And same as before, the patients were instructed not to exceed 75% of their maximum pulse rate. Results. To be included in the final data analysis, the participants had to have attended at least 80% of the training sessions. And guess what? There were 0 dropouts, and there were 0 reported side effects. And a high adherence to diet was reported in all 3 groups. Okay, so let's take a look at the data table for Group A, which was diet therapy only. So that's basically our control in this study, okay? So as you can see, this did reach statistical significance for waist circumference. These folks did lose some waist circumference. However, it did not reach statistical significance for any of the other variables. Okay, Group B was the gym training plus diet therapy. These folks reached statistical significance for systolic blood pressure, waist circumference, total cholesterol, triglycerides, fasting blood glucose, and insulin resistance, HOMA. And finally, the spinning training group plus diet therapy, Group C, they reached statistical significance for systolic blood pressure, diastolic blood pressure, waist circumference, total cholesterol, fasting blood glucose, and HOMA, insulin resistance. And by the way, they also, in Group C, spinning training, the BMI was reduced by 9% in this group at the end of the 6 months. Okay, in conclusion, of the 3 groups, spinning was found to have the greatest improvements in body weight, glucose metabolism, and insulin resistance. Prior to this study, some experts expressed concern that spinning may be too high intensity for the elderly. However, good news, this study demonstrated spinning to be safe and useful if performed with caution. And as we already stated, the subjects were free to modify their bicycle strength. And while they were training, they were monitored for heart rate, blood pressure, pulse oximeter, and glycemia. Working in a group setting and the presence of an instructor may have contributed to increased adherence to physical exercise. Results confirm the effectiveness of physical training combined with diet in the management of metabolic syndrome. And I've been asked to formulate a statement on parts of the paper that aren't relevant to our mock patient in Case 5. All parts of this paper are relevant to the Case 5 patient case. Should the patient wish to begin a group class spinning routine, all he needs to do is join a gym that offers spin classes. So that's easy. And he can monitor his own heart rate to make sure that he stays in the safe zone below 75% of his max pulse with any wearable heart rate device. Should this patient wish to keep a daily food diary, as the study participants did, to ensure that he stays within the calorie range of 24 kilocalories per kilogram, then he could use chronometer.com as his daily food log, and it's a free resource. However, should the patient wish to enroll in a medically supervised group spinning program, he may wish to seek out a more specialized facility than a regular gym. So he might want to contact either a physical therapy studio, a cardiac rehab, or a retirement community for medically supervised group spinning. So that is it for today's Journal Club. Thank you so much for your time and attention. And if you have any questions, feel free to reach out to me via my website, angelataylor.com. Thank you so much.